Okay, so that was a fail. So we'll move on. We'll go to Mary next.
Okay.
So you have 5 seconds to name 5 foundation brands. Go.
MAC, L'Oreal, Rimmel, MUA.
Time.
4 times.
Almost.
Woo!
Almost good.
I didn't even know 5. That was good. That was good.
That was
really good.
That was good. Okay, Aliyah, you have 5 seconds.
Don't do common knowledge. I don't have any.
You have 5 seconds to name me 5 seasoning types. Go.
Seasoning types.
Yeah, like all-purpose paprika. No,
Even helps you.
Is that not a thing?
I think I want to.
Yeah.
I think I want to do this.
You didn't even get one. You didn't even get
3.
Stop. Japan is not a city.
Bella, next time.
No, I need to be
Yeah,
doing.
because it's the first round, I'll give it a
What kind of meaning?
I think that's a bit biased, but anyway.
Okay.
You had 2 practice rounds.
Okay, 5 seconds to give me 5 clothing brands. Go.
Gap, Nike, Adidas, Puma, and Look.
Wow. Wow. Okay, so it's 0-0-0. This is very sad. So we'll get straight back into it, Mary.
Okay.
You have 5 seconds to name me 5 hospitals. Go.
St George's, Imperial College, Guys and St Thomas, Rutherford, and Royal Marsden.
So,
The names are so long. She really got there though.
Chips, you have 5 seconds to name me 5 pieces of equipment you use every day. Go.
Stethoscope, blood pressure cuff, a computer, a car, and my phone. That's equipment.
They actually did it.
Okay.
So what was the second one?
You said the car.
I thought it was equipment.
Is it equipment?
It is equipment.
To get to work, I
To get to
guess.
work, yeah.
No, what was that second thing you
Listeners
said?
always say it.
Computer.
No, you said something else.
The second
Blood
one.
pressure cuff.
Blood pressure cuff.
No, there's something else you said that sounded like.
Computer.
It's because he said
Maybe
it
it
really
was,
quick.
yeah, maybe it was a blood pressure. Okay. Aliyah, you have 5 seconds
Don't know why I'm
to
saying this
name
way.
me 5 items of Caribbean food. Go.
Jerk chicken, curry goat, rice and peas, plantain and coleslaw.
You said it, but see how my accent came out.
This is coming from the
Okay, so it's 1-1. This is the last round, guys. Okay, so Chibs, we'll start with you first because we started with Mary first last time.
I think you should start
and you
with
weren't
Mary.
expecting it.
I just ended
She just ended it. So, yeah. Right, go. Give me 5 laptop brands. Go.
Lenovo, Toshiba, Dell, Apple, Mac as well.
Yeah.
And Mac is an apple. We didn't get that. It was just
So you lost. Well, we don't know if you lost yet, but let's go to Mary next.
Okay.
Mary, you have 5 seconds to name me 5 Nigerian dishes. Go.
Amala, pounded yam, chili.
Stop. I said dishes. Dish. You don't eat amla by itself.
Yes, you can. On its own, you can't have vegetable soup on its own. You have to have something with it.
So amla and spinach would be.
It's just like saying like plantain. Can you have technically you can have plantain? But you can't have potato by itself.
I didn't get that easy question in terms of naming food.
But you've got work equipment. If you don't know what you use every day, that's a problem. And you said car.
So do you think that round counts? Should we do it again then?
Yeah.
Let's do it again. No, you're out. That's it for you. Okay.
Give me so many chances.
5. Actually, give me 5 jewelry brands. Go.
Jewelry brands? I don't know jewelry brands. Swarovski, Pandora. I don't know. I actually don't know.
Time.
Oh,
Okay. So you've got none right, innit? So you're 0.
Yeah.
You're 1.
2, in fact.
2.
Yes.
And you're 1.
How do we get 2? Apple does not
one. He got the work one. And then you've got 1 as well.
Yeah.
Okay, so Aliyah, you have 5 seconds.
Stop it.
Yeah, we could go to something.
I think we should, to be frank.
If I get it wrong, then we have to go to study then.
You have 5 seconds to name me 5 fruits, go.
Apple, banana, kiwi, pear, oranges.
I feel like that was just too easy.
Very easy.
That wasn't fair, was it?
Comment below. Was that easy?
That wasn't fair.
You took 5 seconds to name one vegetable that wasn't a veg.
I don't remember that happening.
Okay, no, we're gonna do a different one. I think that was too easy.
Okay.
I think it should be.
Okay, you have 5 seconds to name me items of clothing. Go.
Top, jeans, tracksuit bottoms, hoodie, and hat.
Yeah.
Okay.
Okay, sudden death, guys. 1-1.
No, I got 2 now.
Is it?
Well, it was 3 if you count the fruit, but 2 is
So you won.
No, she hasn't won.
Yeah,
Sudden
she
death.
has.
So
No,
what
it's
sudden death is?
2-1-0. No, she won. Let's get to
It's
the question.
2-1-0. So she won. So round of applause.
Yeah.
Congratulations. You have to be modest and accept defeat.
You have to.
Chibs, do you know what I mean? You have to. Okay, so let's move on to the questions. So, what I think we should start by doing is just telling the viewers exactly what you guys do, what your professions are. And I know we do this every single time we come on, but we're going to keep doing it just for the new viewers. So, Mary, if you can just let people know exactly what you do and how long you've been doing it for as well, and then we'll just work down the line.
Okay, so I am a senior therapeutic radiographer. So basically it means I specialise in treating adults and children with cancer, and I've been doing it for 5 years now.
Awesome. Okay. So again, my name is Chibs. I'm a cardiac physiologist. I've been so for about 5 years now, in fact. So what I do on a day-to-day is I run diagnostic tests on people. I specialise in echocardiography, so that's the visualisation of the heart, looking at the valves and the movement of blood. I'm doing my exam in about a month's time, very scary, which will accredit, it's basically an accreditation for that as well. So,
I have a question.
fire away.
What you said you're on? You do echo something.
Echocardiography.
What is that?
So, in layman's terms,
What's layman's?
so
Oh my god.
right the way down.
Right. Okay. With you. Yeah.
Bring it right
down.
the way down. Pregnancy scan, just in the chest.
Huh?
So so using ultrasound,
Yeah.
we visualize. We can visualize babies,
Is it?
but
That's how you get this.
yeah.
No, but you said from the heart.
No, so that's what I'm trying to use that as an analogy. Yeah. So when you visualize babies, that's a form of ultrasound. Our form of cardiac ultrasound is to visualize the heart and the structures.
Oh, okay. Nice.
How do you use ultrasound?
Yeah.
Actually? That's interesting.
Yeah.
Okay. Ilya?
My name's Aliyah. I'm a clinical pharmacist. I've been qualified for 2 years. And yeah, basic running of the day is just working on the wards in the hospital, looking at drug charts.
Awesome. Okay, so I'm going to get straight to the questions because we don't have a lot of time. So I've got a whole list of questions that some people have submitted and some students as well. So the first one I'm going to ask, and anybody can answer as well, it says, what do you think your profession is going to look like in the next 50 years? Do you want to answer that one?
After you, sir.
I'll go first. I definitely see it leaning more towards the private industry. Funny enough, I was talking to a few of my colleagues within the current industry. Excuse me. As I said, yep, definitely private. I wouldn't say it's going to be run by machines per se. It's still going to be manned by a man, as in myself. But it's definitely going to lean towards more private. I've noticed that with the current times, there's a lot of people that want to be seen in a private kind of setting. They like that that exposure. They like that in quote pampering. So I definitely see it being private.
Nice. Okay, and I got another question for you. How did you actually get into heart stuff? Because that's not, for me anyway, that's not a normal kind of medical profession. I know a lot of normal doctors, and obviously Aliyah is a pharmacist, but you deal with the heart. Why the heart?
It's a very good question.
Do you get that question a lot as well?
I do, a lot of the time, Let me even strip it all the way back. I remember when I was younger, you asked me, so young as in primary school, you asked me what I wanted to be. I would always say an engineer.
Is it?
Yeah. But unfortunately, I was never good at maths. So
let's not even go there.
Let's not go there.
Let's not even talk
Tears
about
staining maths homework. Why can't you do it simple? Extra tutoring. So
it just didn't help. Yeah, same.
Quite that side. So the next best thing for me that I've noticed that came so naturally for me was sciences, physics, chemistry, and biology as well. First of all, I actually wanted to go into biomedical sciences, but I realised that the patient contact with an individual, you had no patient contact essentially. So I actually stumbled across cardiac physiology. My actual degree was healthcare science, cardiovascular, respiratory, and sleep sciences.
Respiratory is breathing.
Yes, it is. Yes.
And what's the other thing you said?
Sleep sciences.
No, you said before that.
Cardiovascular. So that's what I specialised in.
Cardiovascular.
Yeah. So I always had a love for learning about organs, and I remember when my teacher, I'm a nerd, Mr. Corrigan, if you're watching, God bless you, sir.
Mr. Corrigan.
Yeah, I remember. Shout out Mr. Corrigan. I remember the way we would deal with all the organs. So we would learn about livers and hepatocytes. We'd learn about renal physiology with the kidneys, and when we then focused on the heart, I was like, this is actually quite interesting. We all have a heart. We all have these kind of things, but there was something about the heart that took me, and
Interesting.
Yeah.
So Aliyah, I'm gonna let you kind of answer the question as well, because I know you have a love for science. So what kind of got you into pharmacy as well?
For me, again, it was noticing my strength in science. But unlike Chib, sorry, I was actually really good at maths. It was so for me, it was always maths and chemistry were my favourites. I loved physics and I loved biology, but I knew that I really enjoyed chemistry.
Yeah.
And obviously with all the organic chemistry was my favourite, like breaking down molecules, looking at the chemical reactions and all of that kind of stuff. So for me, that plus maths together, I just researched, and I was like, pharmacy, tick. And then within pharmacy, you have the different kind of sectors. So you have community pharmacy, which is your regular pharmacy. You take a green prescription, you go in, you get your medication. Then you have like research and developing the drugs, so that's pharmaceuticals. And then you have the hospital pharmacy, and nowadays you also have GP pharmacy and pharmacies that work like within that sector. So you can actually go to your GP and see a pharmacist there.
So there's different levels and different kind of types of pharmacists.
Yeah.
Okay,
So,
interesting. Okay, nice. So Mary, when you started studying about cancer and stuff like that, did you automatically think, oh my gosh, like this is gonna be exciting, brilliant, I really want to do this? Or was you like, I don't know about this, but did you just do it anyway? What were your thoughts when you started studying, and how was it studying?
I think it was fun studying, because when I wanted to do it was actually fun, because I had to go to placement as well. So it was like you're learning and you're going to placement as well. So it was nice to see everything that we're learning in actual practice as well. So
okay, so you actually got to do it as
exactly,
well.
So that was good. But I think when I finished studying, when I was about to finish, I was just like, gosh, like this life, do I really want to do it? So I was like, like, maybe I'll get the degree and just go and work in the city and just do my thing in the city. But this life, is it really for me? So no, but actually I think what won my heart again was my final dissertation. And I was just like, actually, this is really where my passion is, and this is what I want to do. So yeah.
Okay, interesting. So Chiz, we're going to ask you, as a cardiologist,
as a doctor, cardiac physiologist.
Do you have any tips for people that might want to do exactly what you're doing? Any students that are thinking about, I think I'm actually interested in the heart as well. What would you say that they should do now that you're actually in it and quite senior in your position? What would you suggest that they do? Any tips or pointers you can give anybody watching?
So I would say pick the appropriate GCSEs and A-levels to it. Always try to be the best. It sounds so, in quote, corny, but you working hard separates you from the crowd. However, I would also say, once you get into the degree, all good degrees will always offer you work experience. I went on about, in my final year, 40 weeks of placement in first year, 10 weeks of placement, so in total 50. So I already knew the job, the ins and outs of the job before I even got a job.
So it's quite intense.
Very intense. So I would say, just be like a sponge, you know, absorb everything, and enjoy the ride.
Did any of you guys have any teachers that you specifically went to about like medicine and stuff? I knew, okay, this is what I want to do, and this is the teacher that is going to help me kind of get to the next level. Did any of you have any teachers?
I did. I think I was really much of a nerd. I was always a teacher's pet. I think every secondary school, I still talk to my secondary school teacher, college teacher, and my lecturer. My lecturer was still very close. So yeah, all my teachers, I went to them and I told them this is what I want to do, and they just more supported me. I thought, yeah, I can do it.
Awesome. So I have a question from YouTube that I'm just going to ask. It says, what's the hardest thing about practicing as a doctor and studying as a student? And Aliyah does this. So she's a senior pharmacist and she's also studying full-time. She's been studying for, it seems like years now. But I'll let her explain how she balances the two.
In terms of balancing, try to make the most out of being at work and the things that you're doing. So when I'm at work, it's, okay, I've got a patient. They're on a heart medication, a blood pressure medication, a diabetes medication. Okay, what does their blood results say? What does their electrolytes say? Is their renal function okay? Can they have this drug? Do I need to hold this drug? And in essence, when you're saying that with each patient, you're actually learning, and that will then come into with your revision. You see the drug and you think, okay, I know it interacts with this medication because when this patient had it, it caused their renal function to decline. So you can make the most out of when you're at work and know that each patient is actually somebody that you can learn from, and they will react differently, and you can use that for your revision. Okay,
but what's the hardest thing you would say while being a full-time student and working?
The tiredness. I've got to be real. Yeah, like you just know that. I mean, just know how to manage your time. Yeah. So I don't know if I did a 9 to 5 shift or a 5 to 12 shift, when my revision will fit into that. Choose the time that you're most likely going to be alert. Some people work better at night, some people work better in the morning. Just make sure that you do it depending on how you feel, and just don't go by what other people are doing. So yeah, just make the most out of your time, set a timetable. I work very well with timetables, and just go from there, yeah.
Love that. Okay, cool. So I'm going to go back to some of the list of questions that I have. So the next one is, patients must be very happy when they see people that look like them looking after them. How important do you think that is to kind of seem relatable to your patients?
Very, to be honest. I think we're a bit fortunate. I don't know if you guys can agree with me. We're a bit fortunate working in London, which is a very multi-cultural area. I myself, I've worked in Northamptonshire. I've worked in Lincolnshire as well, so you can see the difference in...
Tell us about the differences.
It's very different.
Did you experience any racism?
Maybe. That'll be a topic for another day. However, I think it's very rewarding to be working with people and working for people, delivering care for people from different walks and backgrounds, and I think understanding that, but ultimately respecting that as well. So I'll even give you an example. A lady from a particular faith, I would, based on previous, in fact, based on the field, you should understand, based on her belief, without even probably saying, you should be able to offer the service that will be delivered from the same sex, basically, if that makes sense.
It doesn't, I can't lie.
So let me, yeah, so if it's, so let's say, for example, I myself, if I'm doing an ECG, stickers on the chest, looking at the electrical activity of the heart, if I'm doing an echocardiogram, I would offer the option of her having a female echocardiographer as opposed to myself.
Okay, got you.
I can be big and scary, apparently. So yeah.
Okay, awesome. Okay, so maybe move on to the next question. What's the difference between a cardiologist and a cardiac physiologist?
One's a doctor, one's not.
Yeah, but what is the other?
Okay, so a cardiologist is a doctor. They've gone down the route of medical school. They've studied, they've read,
So didn't you go to medical school?
No, I did not.
Didn't you?
Yeah, so I'm not a doctor. Yeah, I'm a cardiac physiologist. So there's a cardiac physiologist and there's a cardiologist.
Interesting. So you don't actually have to go to medical school to become...
Yeah. And that's what I think there's a lot of misconceptions with a lot of people, in the sense that they think that, well, first of all, they think all they see is a doctor and a nurse. There's so many. We'll go into that issue later or whenever.
Everyone's a nurse.
There's doctors and then there's nurses, but there's also other professions.
You see how you end up and there's nurses?
No, not you. There's no hierarchy. There's no hierarchy.
That there's a spectrum.
There's a spectrum. Thank you very much. Yeah, there's a spectrum. Yeah, so there's doctors and there's nurses, and
But
there's
patients don't see that.
yeah.
They just see the scrubs.
The scrubs, and they just think you have to be a doctor or a nurse.
Yeah.
You can't be anything in between.
Yeah, so I've been called a doctor. I've been called a nurse.
Yeah.
I haven't been called anything in between. So it's understanding that. Back to the question, cardiac physiologists will go to university. They will do the standard 3 years. However, there are other accreditations that they will do. So if you want to go into more of the pacemaker side of things, you'll do something called either the BHRS or IBHRE. Don't ask me to quote what that means in terms of breakdown, the IB. Those are exams that are accreditations. Or myself, I am doing the BSc, British Society of Echocardiography. So at the end of doing that and collecting a logbook, you'll be given a certificate. There you are an accredited echocardiographer. Go and scan. Yeah.
So can you just quickly, just so it's clear for everyone else and for me, can you just take us through your route? So you went to nursery. You went to secondary school.
Yes.
You went to primary school.
I didn't skip primary.
Secondary.
You went to college.
Yep.
And then from college you went to university.
University, so 18 to 21, university.
Right. And then straight from university
into a job.
In the hospital.
Yeah.
That's nuts. I didn't know that was a thing.
Yeah.
Okay, awesome. So next question. Anyone can answer this. Everyone doesn't have to answer this because we did touch on this last time as well. How has COVID affected your department?
Yeah.
He's the only one I didn't answer last time.
You're the guest.
Well, guys, I don't know if you can see bags on my eyes, but I'm quite tired. I'm very, very, very tired. So the service, based on COVID, it's been extremely stretched. So because COVID is a virus that affects the lungs connected to the heart. So these are all things that will affect my department. So there will be a lot of referrals. Can I see this patient? Can I see this patient? Can I see this patient? So I could do 10 echoes within a morning session remember, I don't work half time. By the time I get to 12 o'clock, they've done ward round. I've received another 10, 15. So the service is a bit stretched.
Is there enough staff?
There are. However, I'll give you this analogy. In fact, I won't give you that analogy.
No, give us it.
Go now.
Okay, so it's like you have a little bag, right? And you know that one bag will be able to contain this amount of products. But then with that bag, you're putting twice the amount. And then quadruple the amount. Eventually, that bag is going to stretch and it's going to get tired.
Oh, you're talking about yourself.
I'm talking about myself, the bag. Yeah, I'm talking about the bags, in fact, to be honest. Yeah, I'm kidding. No, so basically, there's a lot of patients that we're seeing on the wards. There's a lot of patients that we're seeing on the wards. We're handling it.
Okay.
Consider it handled.
Okay.
Yeah.
Good. Lovely. Okay, so we haven't got long left, so I'm going to speed through the question. How have any of your departments evolved over the last 10 years? I'm really looking forward to, I'm hoping you're going to answer this question because I know you deal with a lot of machines. and stuff like that. I know you haven't been there for 10 years, but you've been there for 5 years. How has it developed over the last 5 years?
I think technology has really, really advanced in terms of, I think, like you said rightly, like the machines we use now, so patients don't have horrific side effects anymore. So if a patient was to have radiotherapy before, if they were a black patient, for example, you would see their skin had got really, really worse. For example, wherever they had radiotherapy to would be, let's say, 3 times or 5 times darker than every other area. Yeah, and it would just be that, it would just be like a rectangle or square wherever we treated, if it was their breast as well. So it would be very, very darker. But now, as technology has advanced, some women don't even have any side effects. They don't even have any skin changes. Like, you would never know except they told you.
Yeah.
Exactly. So a lot of technology has changed. New technologies are being released. Sometimes we'd have to treat patients every day, Monday to Friday, for about 30 days. Now they're bringing shorter regimes as well. So things are really changing, and they're shortening the amount of time patients are spending in hospital as well.
Lovely. Okay, thank you for that. And I've got another question from you too. In all your professions, what's the hardest and best part about it? Aliyah, I'll let you start first, and we can go down the line. Bear in mind this time, guys. So.
The hardest part about my profession would be, for me personally, would be wanting to do more. And I say that in the sense that I know what my job is. I know my job is this chart safe? Do you need to refer something to the doctor? Do you need to let the nurse know something? Do you need to order something for the nurse to administer? But you see things and you want to intervene. And quite frankly, I'm going to be real, there are things that I do that are not necessarily in my job description, but as healthcare professionals, I will help a colleague, So if a patient is struggling and they need help to walk to the toilet, I will run and do that. If a patient is cold and they need a blanket, I will run and do that. If a nurse can't find something, I will run to the meds office and get it. Like, for me, that's the hardest part, is knowing that your job should be this, but you know that other departments are as stretched as you and you want to help. My best part in saying that is the way that every day is different, the way I get to see different patients, the way I get to work with different people. My learning, I don't just have to learn anything to do with pharmacy and medicines. I've learned so much, even by doing ward rounds. So ward rounds, when we look at every patient in the morning with a consultant, you will also learn how to diagnose, how to look at x-rays and ultrasounds, because you need to do it on the ward round to establish what's wrong with the patient. So you're able to learn different aspects that help you then when it comes to the medicines. Okay, how does this work for the patient? So
so your worst thing would be that sometimes you feel over responsible for things and you try and do a lot of things at once. And your best part would be
everyday learning, everyday
you do different things every day. Okay, awesome. Chibs?
I think my best part is exactly like Liz, in the sense that even though I do echocardiography,
these words that you've been using.
Ultrasound.
Ultrasound. Stressing me out.
Sorry, where was I? So the fact that I can do ultrasound, bit of ultrasound, that's what makes me happy. I'm kidding. So that's what makes me happy. That I can do a bit of both. So not only can I do ultrasound, I can also do pacemaker implants, not on myself. That's with working as part of a multidisciplinary team with nurse.
Stop there. Explain to her what a pacemaker is.
You've got to explain to the viewers as
we have
well.
a pacemaker patient, it actually causes our heart to race. Because when you said that, I just thought about
it's tough,
What is that?
So a pacemaker, consider it as
a pacemaker implant, you said,
Yes. Okay, so let's even cool. So you have the plumbing, that's echo, and then you have the electrics, that's pacemakers. So if there's a problem with blood flow, that's your plumbing in your heart. So that's what we look at.
You're going too technical.
No, it's fine.
No, so that's your valves.
The viewers get it.
Cool.
Even if
I hope you guys get it. If you don't, I'll put my and then you message me. Cool. And then you have the electrics. That's the heart basically pumps according to electricity. That's what drives the heart. It's actually electricity. So that's what a pacemaker. That's where a pacemaker comes into play. So with someone that has a problem with their electrics, you then implant a pacemaker, and that sorts that out. So being able to do that, I think that's what makes the day enjoyable. So I'm not just stuck on one thing. I can be put on anything in cardiology because I have the capacity to do so.
Nice. So that's the best part of your day.
That's the best part of the day.
I love how you guys love what you do. Like, I actually love how you guys love what you do.
I think the in quote worst part. I haven't had this in a while, but when you've exhausted all forms of medical therapy and the patient isn't really responding, so it's kind of like you're led down the path of palliative care. So it's a decision that actually we leave to the doctors, so that's why I always emphasize I'm not a doctor, so thank God, because it's a decision that they make, which is quite tough in actual fact, to be honest. Where we are the middle guys, in actual fact, we give them the information. With that information, you decide what you want to do. So I'll give you an example. An old patient, let's say for example, let's pluck her age out, 88. They have one of their valves is severely impaired.
So a valve is what makes the blood go in and out.
Yes.
Yes.
It's like the door.
Yeah.
It's like the door. So let's say for example,
you see it.
It's what gives your heart beat.
Yeah. So like
You literally see it.
yeah, you can see it swimming.
Yeah, I know, guys. I know.
Go on.
So if that door is not working, majority of the times, if the doctor wants to, they will replace that. But in older patients, they won't. And it's sad to say, I think a lot of the times we've gotten case hardened in the sense that I've heard it before. Yeah, but they're not going to touch him because they're too old.
Age,
unfortunately,
comorbidity,
could
risk
unfortunately
versus benefit.
could die on the table. That's with a streak that a doctor has. That's not a streak that they want to be messed.
Okay, Chib, I have to cut you, and I have to be for
Far away, yeah. I'm
just
talking
because of time.
sorry.
Mary, thank you for your answer, by the way. Someone has said that they love this. They love seeing all of your personalities as well. So, Mary, the best and the worst parts.
Okay, so the best thing is always seeing a patient from when they are diagnosed. So, for example, if they're going to see a doctor and the doctor's like, oh, I need a chaperone, so I'll go in, and then they'll obviously examine the patient, and after further tests, they'll tell them, okay, they have cancer, and then seeing them going from every stage of treatment, and then them finishing at the end, and then they're happy, you see their friends and their family, and that moment is just joyous because it makes everything worth it. Every problem that we've had to problem solve worth it. So that's the best part, and it can never get old. The worst part would, I think, very much like both of you guys said, when you see patient going down the palliative side, or when you feel like, okay, I just want to do more for this patient, and it's just like you really can't do anything more, and it's like you're calling different hospitals, you're calling different professions to see how you can help improve them. Almost like you almost feel the need, like you want to help them take that pain away, but it's like, how do I do that? So that's always the worst part, because you just want to, make them feel better, especially if they have, really, really young kids, or even seeing little kids in pain as well. That in itself can be very emotional and quite hard to deal with.
Okay, awesome. So another question, how do your teammates or other healthcare professionals aid the running of your days?
You can go first.
So for me, it depends where I'm working. Different wards run differently. So the ward I'm currently on is the acute medical unit, and that has different bays within the ward. So we have a team of pharmacists that are allocated to those bays. So the run-in genuinely is that the workload is shared. You'll have one pharmacist who coordinates everybody. So they'll go to the triage meetings. We rotate that role, but they'll go to the meetings with nurses, doctors. Someone will do ward round, and then we'll collate all the information and share that amongst our patients. So it is a lot, but it's all right because you have a team. And then again, So ward round, you'll be with your doctors, you're helping them with their decisions, and vice versa. Then you've got triage meetings, so you're also helping nurses. Then you've also got, which is another part that people don't see, so you've got like STAR team, OPAL team, which they're people that look at like social things. So can the patient go home? Do they need package of care? Do they need carers coming into their home? Have they got relatives that will help them?
Would those people give people crutches and stuff?
Yeah, so they'll give them Zimmer frames, they'll give them sticks.
Are you laughing at me?
No.
They'll check mobility. So for me, I think patients come in, and again, we've already established that they'll just see a doctor and a nurse, but you don't know there's like 12 different healthcare professionals just for one patient working together to make sure that you're looked after here and you're going to be okay when you get home and won't have to come back.
Right.
So for me, yeah, that's the running.
Another question, what team administrates the drugs for the person to have at home?
It depends what drugs we're talking about. So you have a separate team that will come into a patient's home. Let's say they have to go home on IV antibiotics. There's a specific team that will come in and give them their...
What's IV antibiotics?
So intravenous is the one that goes through the veins. So that one will take a specialist nurse. But then you have normal nurses that can come in and just... or carers that just administer meds for maybe a blister pack or like a box of tablets. Okay. So it depends on the severity of their care, on who they'll need to come into their
severity. Okay. All right. Okay, lovely. Chips?
What was the question again? I was just so blown
How
away
your team-
by
It was a good save.
It was a good save. How does your team help you, basically? How do they help you during your day?
How do they help me? Like Lee was saying, it depends who I'm working with. Individuals, yeah, but where I'm working and who I'm working with. So if I'm doing scans, I don't need any help because it's a solo one-man job, Mr. Solo Dolo.
Sorry, can you take me through a scan? So say I'm there for a scan.
Okay.
What are you gonna do?
So hi miss. Yeah. So hi miss.
miss.
No. So let me.
How do we get there?
Let me do my. Let me do my spiel. So hi miss. I'm one of the cardiac physiologists here. My name is Chibs or AJ. If I know, she's gonna butcher my name. AJ is my middle name. Chips. That gets on my nerves. So if I can discern there's gonna be something funny going on, I'm gonna be like, I'm gonna say my name is AJ.
Fair enough.
Cool. So my name is AJ. I'm one of the cardiac physiologists here. Here to do a scan. Jelly on the chest, bit of press on your left hand side. Okay.
Slowly, not jelly in your chest. What's it? So, what do you do, sir?
So, what I actually do is a probe, ultrasound jelly. I get them to turn over onto their left hand side, take the top things off, or if they're not comfortable, just lift it up, and then I press on their chest. So, we have 4 positions.
At the back or the front?
Oh, the front of the chest. Yeah. So we have 4 positions. We have the parasternal long axis view. That's in the
parasternal.
Yeah, parasternal long axis. That's on around this area of the chest. Then next we have the apical forechamber, or the apical region. That's on the side here. Then we have 2 more. We have the subcostal views. So that's just on the stomach. We get them to lie flat. And if you're really trying to look at the aorta, that's one of the biggest arteries within the body. You go for the suprasternal notch. So with them still lying down, you get them to tilt their head back and you visualize the aorta.
Do you have to put stuff down their throat?
No. No.
That's a completely different.
You really love what you do, innit?
It's interesting.
You said apical tunnel or something.
That's
a very interesting word.
Yeah, apical forechamber.
Yeah,
so that's the view you're able to see both the left and right hand side and the ventricles and the atria. Yeah.
Interesting.
Yeah.
Very interesting. Mary, did you forget the question?
The team. What's best about your team? Right?
No.
How do your team help you?
How do you
Help
help
you at the end of the day,
I actually work with a very good team because I know they watch sometimes.
I'm just gonna go back tomorrow.
If you weren't watching,
Dear Mary, we saw your Insta live and it was quite
And you didn't give me a shout out.
acceptable.
So yeah, I think like everyone said, my team is quite good. So we divide all the tasks that we need to do. So when the patient has been diagnosed, we have to do like the pre-treatment scan. So some people will do that. Some people will do the actual treatment.
What's a pre-treatment scan?
So you know how people have CT scans and MRI scans. So our own CT scan is very different in the terms of they're actually lying on the kind of bed that they will be treated on. So the bed is very hard, and they're in the same position they will be in for treatment as well. So we give them tattoos or we give them little markers that can show up in the scan as well. It's a long story. I'm not going to go into that today.
Okay.
So we divide it, and then treatment as
real
well.
tattoos.
Yeah, like a little dot, literally.
Oh, okay. So the laser knows where to go for the treatment.
So yes, so the tattoos are for positioning the patient. So the laser would be reflecting on the tattoo. So we have to move the patient to get them in the right position for treatment. So we're not treating anywhere else we don't want to treat. If that makes sense. Okay. So we have two machines. Some people can be on proton, some people can be on another machine. So we basically talk in the morning when we get there, and we kind of split the day up between ourselves. Who's going to do phone calls? Who's going to do what?
Briefs.
Yeah.
Or do you all have morning briefs?
Yeah.
My morning brief is I have to. My morning brief is my my rota. And your brief there. However, if I'm working in the lab, we brief there as well. So we have a chap that's coming in. He's got triple vessel disease. We're going to be doing an angiogram just to visualize the coronary arteries.
Sometimes when he says that stuff, do you know what he's talking about? Or sometimes they just like...
Of course. You have to.
You can't say no.
Do you know what? It starts off as medical jargon, and if you're a student that's out there or you're getting into the industry, you're not going to know anything. Trust me, you're not going to know anything, and you're going to be, you're not going to understand. But after a while, you get familiar with the lingo. So when someone says echo or da-da-da-da, you understand it. Yeah.
And watching a lot of medical TV shows was good as well, because I enjoyed it. So I was always able to go and read about it as well. And I don't know about you, when you're on placement, they ask you questions like, what does that mean? They ask you to test you to ensure that you understand it.
Okay, so we're going to round up now, guys. So I would like each of you to talk to the camera and say three tips for students. So in your specific industry, so obviously the heart, cancer, pharmacist, and obviously I'll give you some tips on being great as well. But so just give us 3 tips each for students, what to expect, what to do, how can they prepare to get into the industry that you guys are seniors in. Mary, you don't have to start because you just spoke, so any of you.
3 tips on how to get into the industry.
For students. Anything you can suggest for students that
I would say if you're like on placements and work experience and things like that, just make sure that you take every opportunity to learn. When you don't know things, write it down and go and research it after. And if anything, you can just either when you go back the next day, ask the person or even just email them. Everybody loves a keen learner. So you can always tell the difference between someone that's actually interested in shadowing and someone that's just there to be there. So just ask questions and learn whilst you get the chance, because once you're qualified you can ask questions but it looks a bit like my guy. Like,
next two.
Another one would be enjoy it every step and don't put too much pressure on yourself. You will learn throughout your career. I'm like we mentioned earlier, I'm on my 2nd degree now. So I'm still learning, I'm still developing. But take each step as it comes. Baby steps still move you forward. And third thing
That's a good one.
Third thing would be make sure you enjoy it. Like I know people that go into certain careers because their family want them to or because they think it would get them a lot of money. Just to let you know, NHS is not going to pay you enough. So don't do it unless you don't want to do it, because you have to actually, as you can see from us all speaking, we all love what we do, and I wouldn't see myself doing anything else. I love waking up in the morning and going to work. So if you're not going to love what you do, don't do it.
Don't do it. Awesome. Thank you, Dr. Pharmacist Aliyah.
Yeah.
Dr. Chibs, the Heartman, tell us. Free tips.
Free tips. I want to echo exactly what Aliyah said in regards to having fun. As you can see, I can be a bit funny. But trust me, when I'm with my patients, I'm very serious. But don't take yourself serious. When you're in the working environment, you need to have fun. That's the only way that will keep you working. Like Aliyah said, a lot of the times people go into the NHS or into different endeavours based on pressures that have been put on them, or oh yeah, I come from a family, not me. No way. I come from a family of like 5 doctors. Oh my gosh, you need to be the 6th. No.
Do you?
No, he said
no.
So I'm just giving that as an example. You do what you want to do. You don't have to be a doctor. You don't have to be a nurse. You can find the NHS is vast enough that you'll find your own niche within the industry. That's 2. Number 2. I never say have fun. Oh gosh, I said have fun. No, read hard, study hard, read your books. No question is never a silly question when you're on placement. Ask a lot of questions. In the realms of cardiology, there's a website called the LIFTL, Life in the Fast Lane. That is our bread and butter. That is where I even go and consult. 5 years in the industry, I still go there. And lastly, buddy up. Anybody else that's in the industry, even if it's a doctor as well, buddy up with them, speak to them, iron sharpens iron.
Awesome. Lovely, thank you. And Mary?
I would say know your anatomy. Like everyone has said, just have fun whilst you're doing it as well. And the third one would be, don't get into a cycle of this is just another patient, because that's how you lose your passion for it. Think about it as that's someone else's mom, that's someone else's dad. Don't lose track of your emotions or why you wanted to do it.
Right, okay, lovely. Thank you so much, guys. This has been like my favourite one so far. This has been so fun. So, our Instagram is...
We are the House of Medics.
Our YouTube is
House of Medics.
Okay, just yeah. But also on LinkedIn, on We Are House of Medics as well. If you guys wanna, and our website is houseofmedics.org. See how he said it after one of our scenes.
I just want you guys to go first,
right? Okay, so
exactly.
If you guys want to quickly tell the viewers your social media acts as well, and then we'll just finish there.
So mine is at MISSOLADELE, Miss Oladele.
Instagram C_Nwimo NWIMO or Heartman. Or Heartman. Yeah, just Heartman.
Mine is Miss Aliyah _, so that's MSALIYAH_.
And guys, mine is Tanesha TANESHAA_X. So thank you so much for tuning in. If you have any questions for any of the individuals that are up here, go to the House of Medics Instagram page and you'll find them all there. Feel free to DM them or ask them any questions on their separate pages as well. So thank you for tuning in, guys, and we'll see you in a couple of weeks.
Bye.
Thank you.